Now, the mandate is generating major pushback from public employee unions.
They are vowing legal action and predicting dangerous staffing shortages that could impact public safety. CBS 2's political reporter Marcia Kramer joins us with that part of the story. Marcia.
Well, Christine and Maurice, union leaders say they have members who simply don't want to put the vaccine in their bodies. We're talking about cops, firefighters, sanitation workers, and emergency medical personnel. A shortage in each of those agencies would be felt by people in the city in a very big way.
Thousands will walk off from EMS, thousands of others will walk from fire, thousands of others police officers will walk off.
EMS Union President Oren Barzilay meeting with dozens of angry emergency medical workers who, for a variety of reasons, are ready to leave their jobs rather than comply with Mayor de Blasio's vaccine mandate. And while worker shortages can affect public safety, Barzilay says a shortage of ambulances can lead to more serious consequences.
People will die. When it comes to EMS, minutes count. When you have a life and death situation where you stop breathing and you don't get an ambulance there within 4 to 6 minutes, clinical death begins. There's no time to play here with people's lives.
Only 50% of EMS workers are currently vaccinated, 60% of firefighters, 71% of cops, 60% of sanitation workers, and 51% of correction officers.
I think city services are going to be affected. I really do. No matter what agency you're talking about.
Sanitation Union President Harry Nispoli, head of the Municipal Labor Council, says the city's unions intend to sue. They want the mayor to offer religious exemptions, a weekly testing option, and in some cases, recognition of a theory that workers who have had COVID have immunity to the disease. He also says that if thousands of city workers balk at taking the shot, the city could be faced with hundreds of millions of dollars, if not billions, in overtime. Mayor de Blasio, who is reportedly eyeing a run for higher office, is okay with shelling out more money, even though it could saddle his successor with the bill.
Obviously, we'll use overtime when we need to use overtime. We'll do redeployments when we need to do redeployments. We have a variety of ways we can adjust the use of the workforce. We feel confident that even if there's some temporary dynamic of some people not being ready right away, that we're going to find our way through it.
Still, there are a lot of people who say they won't get the shot. James Daly, a retired FDNY 3-star chief, says his 3 sons who work for the FDNY won't get the shot.
I'm here to fight for their right to choose. They were the heroes of this city. And now they're being demonized by this mayor who's looking to take away their paycheck.
I would be dishonoring God if I did take this vaccine.
Well, Bill de Blasio's successor will have to deal with staff shortages and new overtime costs. Democratic mayoral nominee Eric Adams says it's essential to get city workers vaccinated, but he says the city needs to work with the unions to make sure there's a buy-in. Republican Curtis Sliwa is against forcing city workers to choose between a shot and a job. He says they should be offered a testing option. Maurice and Christine?
Okay, Marcia, thank you.